Hi everyone, and welcome to this presentation on lung cancer and its prevention. Lung cancer is a disease where abnormal cells grow out of control in your lungs. These cells can form tumors that interfere with the normal function of your lungs and spread to other parts of your body. Lung cancer is the leading cause of cancer death for both men and women in the United States. Non-small cell lung cancer, or NSCLC, is the most common type of lung cancer, accounting for about 85% of all cases. It usually grows and spreads more slowly than small cell lung cancer. There are several types of NSCLC, such as adenocarcinoma, squamous cell carcinoma, and large cell carcinoma. Small cell lung cancer, or SCLC, is a less common type of lung cancer, accounting for about 15% of all cases. It usually grows and spreads more quickly than non-small cell lung cancer. It is also called oat cell carcinoma because the cells look like oats under the microscope. Lung cancer can block or narrow your airways, making it hard for you to breathe. It can also cause fluids to build up in your lungs or around them, which can lead to pneumonia or pleural effusion. Lung cancer can cause bleeding in your lungs and forces you to cough up the blood, which is known as hemoptysis. Lung cancer can cause pain in your chest, back, shoulder, or arm. It can also cause you to lose weight as it affects your appetite, metabolism, or digestion. Lung cancer can make you feel very tired and weak. This is because it can affect your oxygen levels, hormones, or immune system. The most common risk factor for lung cancer is smoking. Smoking damages the cells that line your lungs and makes them more likely to become abnormal and cancerous. The more you smoke and the longer you smoke, the higher your risk of lung cancer becomes. According to the American Cancer Society, smoking is responsible for about 80% of all lung cancer cases. Secondhand smoke is also a major risk factor. Exposure to radon, a radioactive gas that can be found in homes, is another significant risk factor for lung cancer. Air pollution is also a risk factor for lung cancer, especially for people who live in areas with high level of air pollution. Other risk factors of lung cancer include exposure to asbestos, certain chemicals such as arsenic and vinyl chloride, family history of lung cancer, certain genetic mutations, and other medical conditions such as chronic obstructive pulmonary disease, HIV infection, and tuberculosis. The symptoms of lung cancer can vary depending on the type and stage of the cancer. However, lung cancer may not cause any symptoms in its early stages, or it may cause symptoms that are similar to other common respiratory problems such as bronchitis or pneumonia. Therefore, many people with lung cancer may not be aware of their condition unless and until it is advanced or has spread to other organs. Some of the signs and symptoms of lung cancer may include a cough that does not go away or gets worse, coughing up blood or rust-colored sputum, chest pain, shortness of breath, wheezing, weight loss, fatigue, bone pain, difficulty in swallowing, and hoarseness or voice changes. If you have any of these symptoms, especially if they last for more than 2 weeks or are unusual for you, you should see your doctor as soon as possible. Your doctor will initiate a comprehensive clinical examination and ask you about your medical history, family history, smoking history, and exposure to any environmental or occupational hazards. Chest X-ray is a simple and painless test that uses X-rays to take a picture of your chest. It can show the size and shape of your lungs and detect any tumors, fluid, or any other abnormalities. Computed tomography scan is a more detailed test that uses X-rays and a computer to create cross-sectional images of your chest. It can show the location, size, and shape of any tumors as well as any enlarged lymph nodes or metastasis or spread of cancer to other organs. Magnetic resonance imaging or MRI scan is a test that uses a powerful magnet and a radio wave to create detailed images of your chest. It can show the extent of any tumors as well as any involvement of the brain or spinal cord. PET scan or positron emission tomography is a test that uses a radioactive substance called as a tracer that is injected into your vein. The tracer travels through your bloodstream and collects in areas where there is high metabolic activity, such as cancer cells. A spatial camera that detects the tracer and creates images that show where the cancer is located and how active it is. Biopsy is a procedure where a small sample of tissue is taken from your lung or another organ where the cancer has spread. The sample is then examined under a microscope to confirm the diagnosis of lung cancer and determine its type and characteristics. Molecular testing is a type of testing that analyzes the genes and proteins of the cancer cells. It can help identify specific mutations or changes that make the cancer cells grow and spread. It can also help guide the choice of targeted therapy or immunotherapy for some types of lung cancers. Smoking is the main cause of lung cancer, so quitting smoking or never starting is the best way to prevent it. If you smoke, talk to your doctor about how to quit. There are many resources and treatments available to help you quit smoking, such as nicotine replacement products, medications, counseling, support groups, apps, and websites. Quitting smoking will not only reduce your risk of lung cancer, but also improve your overall health and well-being. Secondhand smoke is the smoke from other people's cigarettes or cigars, as well as smoke that they exhale. When you inhale secondhand smoke, you are exposed to many of the same harmful chemicals as smokers. Secondhand smoke can increase your risk of lung cancer by 20 to 30%. Therefore, you should avoid breathing in secondhand smoke as much as possible. You can do this by asking people not to smoke around you, choose smoke-free places to live and work, and supporting laws that ban smoking in public places. Radon is a radioactive gas that can be found in homes. You can reduce your exposure to radon by having your home tested and, if necessary, installing a radon mitigation system. If you live in an area with high levels of air pollution, try to limit your time outdoors. Eating a healthy diet that is low in processed foods and high in fruits, vegetables, and whole grains can help reduce your risk of lung cancer. Exercise can help reduce your risk of lung cancer by improving your overall health and fitness. Flu, pneumonia, chronic obstructive pulmonary disease, or other similar conditions can weaken your immune system, making you more likely to develop lung cancer. Therefore, getting vaccinated against them is the best approach to improving your immunity and reducing your risk of lung cancer. Lung cancer is a serious disease, but it may be prevented with awareness and by avoiding its potential risk factors. By taking steps to reduce your risk of lung cancer, you can help protect yourself from this life-threatening condition. Thank you for watching. I hope you found this presentation informative. Do not forget to subscribe to this channel and hit the bell icon to get authentic updates on health, wellness, and disease prevention strategies backed by the latest scientific evidence.